Gill.
Thank you, Madam Deputy Speaker. I rise to support this bill and speak to new clauses 22 and 23, which have been tabled in my name. The measures in this bill will unlock the power of data to grow the economy, to improve public services and make people's lives easier. And by modernising the way consumers and businesses can safely share data, this bill will boost the economy by an estimated $10 billion over the next decade. This bill will also make our public services more efficient and effective, saving our frontline workers millions of hours of bureaucracy every year, which they can now use to focus on keeping us safe and healthy. I welcome the Minister's mission to update government for the modern digital age. Any responsible government must use data to build an accurate picture of who it is serving. It is because I recognise the incredible power of data that I tabled my probing amendments on the need to record ethnicity data for Sikhs and Jews. If some communities are invisible to public bodies, how can we expect them to be served equally? Madam Deputy Speaker, I have tabled these amendments to put a right wrong. That ethnicity data that public bodies collect is often patchy and incomplete, and that for Sikhs and Jews specifically, data isn't collected at all. Jews and Sikhs have been legally recognised as ethnic groups for over 40 years, since the Mandela v Dowley case in 1983, and this was reaffirmed in the Equality Act 2010, where they are considered as both religious and ethnic groups. And as protected characteristics, you would expect that public bodies are instructed to routinely collect information on Jews and Sikhs, but they are not, especially when public bodies only use ethnic categories to deliver public services. This is why this really matters. Jews and Sikhs therefore face discrimination, which was further evidenced by the 2017 race disparity audit, which found no data on Sikhs in the 340 datasets assessed across government. And in recent years, Jews and Sikhs have only been recorded in religious data. However, religion data is rarely collected to a good standard, if at all. It excludes secular and non-practicing Jews and Sikhs, and it is not used by public bodies to monitor and reduce inequalities or provide public services. So how are we meant to tackle discrimination and inequality if Jews and Sikhs are invisible to policy makers? That is why new clause 22 in my name proposes to make it a statutory requirement for public bodies to collect ethnicity data and ensure that within that, public bodies are required to collect data on Jews and Sikhs who are currently excluded. New clause 23 targets a more specific but no less important point about the health inequalities that persist as a result of inadequate data. New clause 23 specifically targets the provisions in this bill about the register of births and deaths. In order for this to be meaningful, surely the Minister agrees that Jewish and Sikh deaths matter. So if they are not included, what message is this sending to both these groups? The pandemic revealed the tragic consequences of failing to recognise the health inequalities between different ethnic groups. And many experts in public health now accept that we were too slow to recognise that some ethnic groups were dying at a far higher rate than others. And the Office for National Statistics belatedly started analysing COVID-related deaths data by religious group, a short-term exercise that has since been discontinued. And it found that Sikhs died disproportionately from COVID even after adjusting for other factors. Not only that, it showed that Sikhs were affected at a very different rate from other predominantly South Asian groups, demonstrating the inadequacy of the existing ethnic categories. And the same goes for Jews, who are often missing from data that the NHS collects, as acknowledged in a report from the NHS Race and Health Observatory published in December. British Jews also died from COVID at almost twice the rate of the rest of the population. And certain genetic conditions also have a higher prevalence among Jewish people. For example, breast cancer in Ashkenazi Jewish women. This amendment would therefore take forward one of the Race and Health Observatory's key recommendations to mandate the inclusion of Jewish as an option for ethnicity, allowing us to collect essential data for tracking health outcomes. And it is, of course, right that we do the same for the Sikh community too. So will the Minister commit to accepting these amendments, given the significance of the arguments in their favour? England and Wales is behind other countries on this. The United States Department for Health has recorded ethnicity on death certificate records for decades. Scotland has recorded ethnicity as part of the death registration process since 2012. And in October 2020, during the pandemic, The previous government announced plans to adopt the measure in England too, but despite warm words from the then Minister for Equalities, now Leader of the Opposition, no action was taken. So I'm pleased that the government is taking forward important changes to ethnicity data collection within the deaths registration process, but as it stands, the process would pretty much replicate the inbuilt bias against Jews and Sikhs who don't have their own specific categories in ONS-designed ethnicity questionnaires. They are simply relying on existing recorded information for ethnicity. My amendment would change that, making it mandatory for public bodies to collect ethnicity data for Jews and Sikhs. After all, it is not religious differences that make Ashkenazi women more susceptible to breast cancer. The distinction between recording ethnicity versus religion is the difference between Jewish and Sikh communities being counted and not. Good quality data saves lives. And that is why I introduced a 10-minute rule bill on this issue to the House last year. And my campaign had wide support from both the Jewish and Sikh communities. I do not intend to bring my amendments to a vote, but I hope the government will bring forward changes which mandate the inclusion of Jewish and Sikh ethnicity categories for the purposes of public service delivery. I fully support this bill's mission to unlock the power of data to transform lives. That data must be fair. Sikhs and Jews must no longer be invisible to policymakers. Thank you.